Bonjour à tous. Thank you for joining us. Merci d'être parmi nous aujourd'hui. My name is Kendra Titley and I will be your moderator. Je m'appelle Kendra Titley et je serai l'animatrice de ce point de presse. Before we begin, a quick reminder to place your phone on mute until I invite you to speak or to ask your question. And please do not place the call on hold. Available for questions from the media, we have disponible pour répondre aux questions des médias nous accueillons in Council Chambers, Mayor Le Maire Jim Watson, Steve Kanalakos, City Manager, Directeur Municipal, and Anthony DeMonte, General Manager of Emergency and Protective Services, Directeur Général des Services de Protection et d'Urgence. And phoning in today, we have Dr. Vera Etches, Medical Officer of Health, Médecin-Chef en Santé Publique. I will now invite each agency to ask their question. You may ask one question with one follow-up. Par ordre alphabétique.
I will now invite each agency to ask their question. You may ask one question with one follow-up question.
If for some reason we lose you during the call, please try phoning in again or contact medias to submit your question. We'll now start with Joanne Chianello at CBC Ottawa.
Hello. I actually have a question for, I think it's either Dr. Etches or Mr. DeMonte, or maybe both of you, from my colleague, for our colleague about the COVID situation, which is getting, looking better every day. Let's hope that continues. We heard from Dr. Remiliotis about what he'd like to see, what he wants to see to be back at pre-pandemic levels, kind of in the fall or Christmas, that that there's going to be few restrictions on gatherings or practically no masking. And I know, Dr. Etches, I talked a little bit with you about that on Monday, but I'm wondering if both of you can talk about what you want to see before we can return to something resembling pre-pandemic normalcy. What kind of numbers are you looking for? What the vaccination rate has to be? And when that might happen? Thank you.
Sure. It's Dr. Vera Etches here. So what we know is that right now what's keeping COVID from transmitting at an exponential rate is two things. It's the masking that we're using and the distance between people and the vaccination rates. And so we need to continue these protections until we're confident that the level of immunization and immunity from infection in our population is sufficient to keep resurgences from an exponential growth that reaches people who are vulnerable to serious illness. And so it does mean full protection for as many people as possible. We're talking about aiming for 90% of the eligible population with 2 doses. So we aren't there yet. When you think about it, we have 70%, which is progress. It's amazing progress, thanks to all the teams. People in Ottawa, 70% have their first dose. But that does mean that there are 300,000 people in Ottawa still without a first dose. Now, a number of those are children under 12. And so that is a population that's never going to be eligible for the vaccine, about 130,000 people in Ottawa. And so we need the coverage rate for those above 12 to be as high as we can. The transmission of COVID we're seeing around the world is continuing more so now in the unvaccinated population. And so when it circulates in younger people who aren't vaccinated, it can lead to still people who are older, more at risk for serious illness, getting hospitalized and even death. And so we have to monitor as we go step by step, more close contact indoors, more people back in the workplaces, to see, are we able to keep the serious illness at a low level? And so this is something that is still being studied around the world. We need time to monitor that into the fall. The summer is an excellent time to be outdoors, but we're going to have less of that opportunity into the winter. So again, it's too early to say exactly when we'll be able to have confidence that the immunity is sufficient to be able to really go back to no practices at all that are aimed at decreasing COVID transmission.
Yeah, and Joanne, it's Tony DeMonte. I don't want to add anything. I mean, I think Dr. Etches has clearly indicated for her and what we need to achieve, and we're well on our way. And I just want to encourage, if we do want to get to that situation, people have to continue coming to receive. And those who haven't received the first dose, please do. And those who've had their first, move up your second dose. We've got capability in the system, and I think that's going to be one of the big indicators. And then Dr. Etches and her team and her colleagues can look at the other indicators of hospitalizations, et cetera. So if we want to get back to some semblance of normalcy, this is the first key element that we need to achieve.
All right, thank you both very much. And follow-up is for Mayor Watson. Great news on the bridge today, but we missed you after FEDCO yesterday, and I want to ask a Lansdowne question, and that is, it's very preliminary, the idea of looking at rebuilding the North Side stands, the Civic Center. It's a bit confusing because, of course, OSEG has been dealing with them and paying for the upkeep, I guess, since 2012, but it is a city facility. And I'm wondering, as the mayor, would you be open to taxpayer money going into rebuilding the North Side stands, and how much? It is a big, huge project, and I'm wondering what you are willing to commit to that project at this point.
Well, I'll support, obviously, the staff recommendation that FEDCO approved. I had to leave the meeting just before that issue began to meet with the federal minister on a couple of important issues. But obviously, we own the public facilities such as the Aberdeen and the horticulture building, as well as the stadium and the arena. What we've asked staff to do is come back and look at alternative sources of revenue other than tax dollars, whether that's a ticket surcharge, whether it's air rights, and so on, so that we can ensure the viability of the seating arrangements in the north side and determine, how we accommodate a smaller arena of about 5,000 seats. So I think this is the first step, or the second step along a long journey. Obviously, I'm very pleased with Lansdowne. It's a vast improvement over what was there before. We all remember the old buildings that were ready to be torn down, and acres of asphalt covering the site, virtually no green space. So it's been a vast improvement, but like every other business entity around the world, obviously the last year and a half have been extremely difficult, with all of the business streams basically shut down. Special events, musical concerts, sporting events, and retail all hurting, and restaurants as well. So I'm enthusiastic about the staff approach that they have put forward. You saw that support by a lot of people in the business and entertainment and tourism communities that came out and supported the staff recommendations. So I look forward to the next couple of steps as we continue to revitalize that very beautiful asset in our city core. Thank you.
Thank you.
Thank you very much. We'll now go to Eric O'Brien at City News Ottawa.
Good afternoon, everyone. Well, just almost. My question is for Mayor Watson. Now, my YouTube was a little glitchy a while ago, so maybe I could just get a few lines on the renaming of the Prince of Wales Bridge, why it's important to you, when the project could be underway and completed, and just a little bit on the $9 million as well.
Yeah, thank you very much, Eric. It's a really, as I said at Council, the renaming of the Prince of Wales Bridge to the Chief William Commanda Bridge is both important symbolically in terms of our road to reconciliation, but also it is a great project in and of itself because this was a bridge that was decommissioned many years ago. The city bought it a couple decades ago, and it really has been shut down for public access for safety issues for a long time. So what the project will entail is working with the federal government and our local contractors and Algonquin communities to turn that unused bridge into a multi-use pathway that people can cycle and walk over to Gatineau and back to Ottawa. In the winter, they can cross-country ski. And it's just another in the many bridges that we have built in the last 10 years. You think of the Flora Footbridge and the Odawa Crossing and Overbrook Sandy Hill and the Rideau River Bridge that's being constructed for LRT, the Jackie Holtzman Bridge in the west end of the city. So this is a continuation of us either building new or rehabilitating existing bridges that bring communities together. And I think if you've seen some of the drawings, it looks really an exciting project that will be very, very well used by pedestrians, runners, cyclists, and skiers. Thank you.
Thank you. Now, my follow-up question, I'm not sure exactly who to address, maybe Dr. Etches, Mr. DeMonte, or even possibly you again, Mr. Mayor. We're seeing other cities like Calgary start to remove the mandatory mask bylaw. I know, if I'm not mistaken, ours here in the city is supposed to expire in August, around there. Is it something that's being considered and removing it early, or we could even possibly see an extension to the bylaw?
I'll ask Tony to comment on that, because we're a little different than the province of Alberta in terms of it's the province that directs us on these matters. Tony?
Yeah, so there's two elements in there. The mayor is absolutely right. There's also provincial direction that we have to follow. We have our local bylaw that Dr. Etches, based on her considered opinion, whether she feels it needs to continue here, if there's gaps that could be helpful. And we're currently looking at that with her and her team, and we'll see the local one. But at the end of the day, the province has a lot to say as well too with regards to masking and the provincial orders there. So unless Dr. Etches would like to add something, I think that gives you an understanding that we are very different than Alberta.
Yeah, I think I would add that as our teams are looking at this, what we know is the provincial regulation that's in place is pretty much has the same requirements as the local mask bylaw, and so the province is taking a look at what's needed over time. And certainly, I think what I'd also like to emphasize is that the masks have provided an important protection that we learned about against many respiratory illnesses. So I understand the desire to get back to not requiring a mask when you're fully vaccinated, and yet I think we've learned something here about besides staying home when you're sick and supporting people to stay home when they're sick, we have new tools that we don't want to see an end to being able to prevent respiratory illness, with some of these tools. So, the requirements, that is something we will be following the provincial, timeline most likely on that. But I just want to tell people not to throw out their masks if they're still, likely useful, and to encourage people to use them as they know can be useful.
Thank you.
Thank you, everyone. Next, we have Ted Raymond at CTV Ottawa.
Hi there. This question is for Dr. Etches. Kind of following a little bit what you said earlier with regard to where we are with COVID right now, where our numbers are doing pretty good. Is it at what point do you think we tell the public that we have turned a corner on this? Have we turned a corner on this disease? Are we beating it? And where are we now compared to this time last year in terms of transmission and where you see the pandemic going?
Sure, we are winning. The vaccine is winning out over transmission of COVID right now, and it's not sufficient yet because we still have a virus here that is more transmissible than the one we saw even last summer. But we expect to stay ahead of it if we can continue to vaccinate and get to those high coverage levels. What we know is that there's still a risk of resurgence, But if we can keep that from going into exponential growth and reaching people who are going to have more serious illness, then that's what we're aiming for. But we're still in the race. We haven't crossed the finish line. We still need masking and distancing to protect against COVID transmission until we can monitor the step-by-step approach. We get back to more people indoors. We assess how that goes. We get back to the fall, less time outdoors, more people indoors. We see how that goes. This is something I feel very hopeful about. I think we can see that the severe illness is being prevented by the vaccine. We just need everyone to have that protection that can, and we're not quite there.
All right, thank you. And as a follow-up to that, last week you mentioned some concerns about maybe some apparent lagging among the 18 to 39 age group. Of course, it is I believe, the largest population demographic in the city in terms of just raw numbers. So are you still concerned, Dr. Etches and for Mr. DeMonte, are you still concerned about that age group maybe not getting vaccinated, or is it just a matter of the fact that there's just so many to vaccinate between 18 and 39 that it's going to take some time to get those percentages up?
Well, I would like to speak to people 18 to 39 to say that the rates are slowing down and the number of people coming forward for their first dose and then for their second dose. And, now is the time. You deserve to have protection from the vaccine and full 2-dose protection. As this is a population we've seen is at higher risk for COVID. The rates of COVID are high for people in their 20s and 30s, and so that protection is important. And now is the time. Right now, we have vaccine supply, we have appointments available in the booking system, and we won't have these mass clinics forever. So we want people to take, the opportunity that exists. You can have same-day appointments now for first doses. This is really an important focus. We want people to understand it protects them, it protects people around them, it helps us get back to the things that we need.
Yeah, I don't have much to add. I think Dr. Etches has nailed it there, and I would again just reiterate, and she mentioned it, at the beginning we were all worried about not having enough vaccine, and the demand was there. We have vaccine. There is a lot of space available. Our clinics are up and running, and I encourage everybody that hasn't had a first dose, please get your first dose. But just as importantly, those who are waiting for their second or have an appointment later on, move it up. There's capability now. Let's get it done. The sooner we hit those 90% targets for 2 doses for everyone, then Dr. Etches and her team can kind of start looking at what it is to the next phase of where we'll get back to some semblance of normalcy in the community. So please come and get your vaccine.
Thank you very much.
Thank you. Nous allons maintenant passer à...
We're giving the floor now to Julien Paquette from Le Droit. Hello, everyone. A little bit like my colleague earlier today, I would like to go back to the Lansdowne Park topic. I would like to have your opinion. We know that the report that was tabled and carried yesterday, we need to work on the northern stands. 10 years after we plan the new configuration of Lansdowne Park. Are you surprised? It was supposed to last for at least 30 years, and now we see that we need to work on the northern stands. No, it was not a surprise. We understand that the northern section had some issues. It was built in 1967. It's been, more than 55 years now. So we have some challenges within the arena. It's our responsibility, OSEG and the City of Ottawa, to work in partnership to find a solution to improve what's going on. When we went through the renovation 10 years ago at Lansdowne Park, The southern portion of the stadium was dangerous at the time. We needed to change and replace everything. That was not the case with the northern section. 10 years later, it's now time to start the discussions and the negotiations with OSEG to make sure that everything is safe for our visitors. Follow-up second question for Dr. Etches. You talked a little bit about it in English, but I would like you to explain. Can you talk a little bit about the Delta variant and what happens here in Ottawa? Because you're talking about a resurgence of potential resurgence of the COVID-19 transmission within the community. So what is your opinion about that? We have a very good situation right now when you're looking at the level of COVID-19 transmission within the City of Ottawa. We don't have a lot of Delta variant right now. But at every single step of the City of Ottawa reopening, there's always a risk of transmission because we have much more contact this fall and in September. We have the younger population, the 12 years and younger, that were not vaccinated. And this would be a possible channel of transmission for COVID-19. We need to be fully vaccinated with 2 doses in order to avoid COVID-19 transmission as well as the Delta variant. So the risk of resurgence is there, possibly more in the fall, I would say. Right now, it's a race with vaccination, a race against the virus. I think we're in a good situation right now, but we have to continue with our vaccination campaign. Like we said earlier, we have some openings, so if we want to make an appointment for your second dose, please go ahead. But at every single step, we're evaluating the level of COVID-19 transmission. We know that the vaccine is protecting you against a serious disease from COVID-19. So we're looking at what's going on at the province of Ontario, but I think we need to continue with wearing a mask and maintaining physical distancing. Thank you so much.
The Ottawa Citizen.
Thank you. It's a question for Mayor Watson regarding Lansdowne, kind of jumping off Joanne's question, but do you think the city has responsibility to pay for the replacement of the north side stands and arena since those are municipal assets, or is it your expectation that no additional tax money will go into creating new infrastructure at Lansdowne Park?
Well, thanks, John, for the question. The bottom line is that the city owns those assets, so ultimately we're responsible for their upgrade and upkeep, although the day-to-day upkeep of the facility, of course, is the responsibility of OSEG. We recognize that the north side stands are coming to the end of their life cycle, and it's necessary for us to start the process now on how we continue the revitalization of Lansdowne. And as the report indicates, and I've certainly stressed with staff, my greatest priority is to secure as much funding from everything from air rights to ticket surcharge and so on, as opposed to going into seeking tax dollars. Will there be a requirement for some tax dollars if there's a shortfall? That's obviously one of the options that we have to look at, because when you own the facility, you also own the responsibility to maintain it. And so I think if, there were 2 elements, if I was to look in a retrospect as to what we could have done when we did the revitalization, we probably, in hindsight, should have done the north side stands Civic Center renovation at the same time. And we also recognize now that we need more people to live on the site, and thus the reason for looking at housing opportunities, both market and affordable, as well as looking at the future of the north side stands and the Civic Centre. It's a complicated piece of real estate, as you know, John, because you've got the Civic Centre connected really to the stands, the north side stands. And at the time, the south side stands were in deplorable shape and were not safe. So they had to come down. We all remember going out there to see the south side stands being demolished. But in hindsight, we probably should have done it all at once. But for a wide variety of reasons, including the north side stands, were still in relatively good shape and could last another decade or so. And then obviously one of finances at the time as well. Thank you.
Thanks, Mayor. Second question for you, different topic. It's regarding the audit for the e-bus procurement. And the AG is getting involved early in this, which to my memory is very unique for Ottawa's municipal procurement program. Usually these audits happen after contracts are signed. So do you hope that the AG gets involved early in more major city procurements?
Yeah, I'm very supportive of Natalie's approach. She and I met on this issue a little while ago, and I indicated that I think this is a much more helpful that she's involved early on and can advise us at the elected level whether there's a potential problem that we should be addressing. And so I would see this as a great a pilot project that hopefully can be repeated for other large infrastructure projects and other large projects. I don't think it's necessary on small audits. You get bogged down and not have enough resources to do the actual audits if you're doing too many of these pre-audits, I guess if you can call them, or pre-studies. But I think it's a really good idea, and another set of eyes on any project of this magnitude is welcome. Thank you.
Thanks, Aaron.
Moving on, we have Blair Crawford from the Ottawa Sun.
Hi, this is a question for Mr. DeMonte. I think I asked this last week as well, but it's about vaccine shopping. I saw a social media post from a pharmacist saying that they're having trouble booking people in for a second shot of Moderna. And I'm just wondering how big a problem you see this as and what can be done to get around it.
Yeah, thank you for your question. I'm actually surprised to hear that for Moderna in particular. That's been a product that we've really in recent times have not had any issues with. Pfizer, as you remember, and I've said this before, there was a bit of a delay, and because it is the only product that can be used for people 12 and 12 to 18, we've been assuring that we have that put aside for them. But that said, we've kind of gotten past that. Now all our sites have both products available. So it shouldn't be an issue, and I would encourage people to not hesitate to book an appointment in one of the clinics or go see your doctor or a pharmacy, and please move forward, and more than likely you will be able to get the product that you initially got is the first option that we always do, and then in rare cases, or not rare cases, but in certain cases, if the product isn't available, you're offered the other mRNA vaccine, but as I said, that shouldn't be a problem. All our sites now have both vaccines available.
Yeah. I think I'd like to jump in there as Vera Etches, because we know these vaccines are interchangeable. So, the National Advisory Committee on Immunization has underlined that. The studies, the science, the side effects, the effectiveness, they're all practically the same. So, in terms of the mRNA vaccines work and the results for protection against COVID. So you can start your series with one and finish your series with the other, and that is considered completing the protection that's required right now for COVID-19.
Thank you. I don't have any other questions, so thanks.
Thank you, Blair. Nous allons maintenant passer à Nafi.
We will give the floor now to Nafi Alibert from Radio-Canada. Hello, everyone. I would like to go back to the bridge and the project cost. Can you explain in French how much it will cost, how much the city will pay, and what you will do? For the cost, we're talking at about $22 million investment. Half of it will be paid by the City of Ottawa using the development charges, as well as using the reserve from public transit. We've also made a request with the federal government for about $8.6 million. We hope that we'll have some more information within the next few weeks. So in total, it's $22.5 million for renovation, construction. I don't know how you call that in French, but it's we have to construct some piers in the water. So we have the support at the community level for that project. This will be an extra link between the City of Gatineau and the City of Ottawa. This will be good for active transportation, either by foot, bike, or ski. So officially, when will you change the bridge's name? What date are you expecting to start renovations and construction? Right now it will be called, actually it is called the Chief William Commander Bridge. It's been approved today at the City Council meeting. So we will be changing the posting on the bridge. As for the construction, we will start in 2021 in a few months. How long would it last, the construction and the renovation? I think it will last about 1 year. Thank you so much.
The time that we have, c'est tout le temps que nous disposons aujourd'hui. Merci. Thank you.